Greetings, and thank you for attending my analysis on recommendations for how medical staffing agencies in the United States can plan for the upcoming influenza season. The motivation for this project is basically the United States has been experiencing a large number of deaths caused by the influenza over the past years, as evidenced by the graph here below in my overview statement. As you can see here, the deaths hover between 70,000 and 80,000 deaths per year, and moving forward, we would like to understand how we can alleviate some of these deaths and also bring this total down by providing adequate staffing throughout all 50 states in the US. The objective is to first clearly define three things. One is, what is considered a vulnerable population, as these populations are experiencing the highest number of deaths in the United States. Two, we like to understand more about which states have encountered the most vulnerable deaths in the US. And third, we want to look at the months with the highest number of total deaths in the United States. These three things we'll look to analyze, and based off of our analysis, we will then look to give these staffing agencies recommendations on how they can allocate staff throughout the 50 states during the upcoming influenza season. Thinking about the scope of this project, again, we're looking at all 50 states in the US between the years of 2009 to 2017. And this is also one of the limitations in our analysis because, again, we're only looking at 2009 and 2017 data, but we'll use that to give our recommendation at the end of this analysis. And lastly, one of our other limitations is we're not looking at the number of vaccinations in each state. Again, this is something we can look at in further analysis, but for our purposes, we'll just stick to the vulnerable deaths in the United States between 2009 and 2017. The data we sourced for this analysis was provided to us by the US Census Bureau and also the CDC, Centers for Disease Control and Prevention. So we can assume that the data given to us is trustworthy and credible. That being said, let's dive right into our analysis and first look at how we define what are vulnerable populations in the United States. Looking at vulnerable populations in the United States, we have four different groups, or I guess ways we can define a vulnerable population. According to the CDC, a vulnerable population is considered either those that include pregnant women, children under the age of 5, people ages 65 or older, and individuals with chronic medical conditions or immunosuppressive conditions. For our analysis, we'll focus on 2 and 3, so children under the age of 5 and elderly ages 65 and older. As you can see here, as we scroll down on our analysis here, we can see in this bar chart that the total number of deaths between 2009 and 2017 experienced by vulnerable populations, which are in red, are significantly more than those of the non-vulnerable populations. This is in line with our hypothesis. Basically, we believe that the more any population within those vulnerable populations will experience a higher number of deaths by influenza. And as we can see here, overall, 71% of the total deaths by influenza are experienced within these vulnerable populations. So again, through our analysis, we know that we have to focus on these populations so that we can get the number of influenza deaths under control moving forward. Moving on to the analysis of vulnerable deaths by state between 2009 and 2017, we can see when we aggregate or we total up the total number of vulnerable deaths in the US, we can see in this graph, California leads the way with almost 50,000 vulnerable deaths. Behind California, we see New York, and then more states within this northeastern kind of midwestern area, a few states in the south as well. Going down to look at more of the specific numbers, we can see that, again, California leads the way, and in our top 15, we can see between California and New York, there's a big kind of drop off, I guess, or a lessening number of deaths. But the top 15 states here, we can see are experiencing at least 10,000 vulnerable deaths in their population. A very nice thing we can do with this graph is we can filter out the number of deaths by year. So again, right now we see the aggregate numbers between 2009 and 2017, but when we click, let's say we want to see the most recent data in our populations, again, California, New York top the list here, and we can see again, there's the numbers of the total aggregate are not that far off what we see, but the top 15 usually stay pretty consistent throughout the years. So moving forward, we believe that understanding which states are experiencing the most vulnerable deaths by influenza, we can understand where better to allocate our resources moving forward. Now let's dive into how we define what is the influenza season. According to the CDC, the exact timing of the flu season varies, but we often see an increase in the case of the flu starting in October, ending in around late May. Through our analysis, we looked at the total influenza deaths by month as an aggregate between 2009 and 2017, and what we found was that, let me click here on this graph, was that the months from December through April had the highest number of deaths. Again, November and October are not that far off in terms of numbers here, and also May, as indicated by the CDC. For our purposes here, we want to look at the top 5 months and kind of understand where we're seeing the highest number of deaths. Again, for our recommendations coming forward, we can start to prepare in the months of October and November, but the high season of influenza, we believe, starts in December in terms of deaths on through March, April, in the months following. So again, the highest number of influenza deaths between 2009 and 2017 occurred between December and April. Finally, we've reached our conclusion and recommendations. Based on our analysis of the data provided by the Census Bureau and the CDC, we believe that allocating staffing resources during the months between December and April and focusing on high need states as defined by the total number of deaths experienced in those states between 2009 and 2017. These high need states are California, New York, Pennsylvania, Tennessee, Illinois, Florida, and Ohio. And medium need states, which would be North Carolina, Michigan, South Dakota, Massachusetts, Georgia, Vermont, New Jersey, and Missouri. These states are defined as in the most need of staff during these high seasons. And so we recommend any staffing agency that is allocating their staff in the United States to focus on these states as listed above moving forward. Again, these states have the highest number of vulnerable populations and the highest number of vulnerable population deaths within their state. In terms of, again, limitations to our study and how we think we can improve it, we'd want to get more recent data past 2017 through the Census Bureau if possible, and also look at the vaccination rates for each state. Maybe we can help prevent some of these deaths by implementing vaccination programs so that the vulnerable populations can receive these and slow down the death rates of these populations in each state. Again, having these rates and having this data will allow us to better understand staffing needs on that level. Moving forward, we would look to do this to be able to provide a clearer understanding of the needs of each state moving forward. Thank you again for viewing my analysis. I appreciate your time, and I look forward to providing you with more data analysis projects in the future. And again, you can reach out to me at www.body-archives.com. My name is Isom Winton, and I look forward to hearing from you in the future. Thank you.